Welcome, everybody. This is Nate Olson here with OCI. I want to thank you all for taking time out of your busy schedules to attend our first virtual event for the Nebraska Individual Health portion of OCI. So we've got a lot of stuff to go over today. We kind of have a little bit of a different format, so I'm just going to go over some housekeeping rules. Number one, you guys are all muted. Just with the amount of attendees we have on here, you guys will be muted throughout the webinar. You are able to ask questions on the right-hand side of your panel. You can ask questions, and we'll try to get to those at the end of each segment. For any of those we're not able to answer, we'll work with the carriers to get a response back and get those back over to you for some follow-up. Format, we will have a carrier start on almost every hour. They'll start about 5 minutes after the hour. I'll do a quick introduction, and then they'll go through, and then at which time we will open up for answers. So again, or questions. So just go ahead and put those into the questions area. If we end early, we will keep the webinar going, and there'll just be a hold screen until that next presenter's time is up. That way, if you need to hit the restroom, refill your coffee, we do have a little bit of a lunch break broken in, so don't feel that you have to attend the entire time. Feel free to pop back in and out using that same link when you need to do so. So again, thank you very much for attending today. Our first presenter is Sebastian Alcantara. I hope I said that right, Sebastian. And he is with Oscar Health, and one of the new carriers here to Nebraska this upcoming year. We're very excited to partner with them as a general agency. And with that, I'm going to go ahead and hand it over to Sebastian.
Thank you, Nate. Thanks for the introduction. I'm very excited to be here, and thank you everyone for attending. So as Nate said, my name's Sebastian. You can go ahead and just call me Seb for short, S-E-B. It rolls off the tongue a lot easier. Very excited to talk to you about Oscar, so let's begin. Our Central regional sales team, headed by my colleague Ben, who's actually new. He is the senior director based out of Chicago. Matthew is really our go-to expert for the entire Central region. He's been on this team for about 3.5, 4 years now. Karen manages our Medicare Advantage product, which unfortunately is only located in Texas as of today, but as we expand, I predict this to be in other states. And again, my name is Sebastian, but just go ahead and call me Seb for short. I'm based out of Arizona, so I'm actually 2 hours behind Central Time, and with the time change during open enrollment, I'll be 1 hour behind during open enrollment. So what we're going to talk about today is just a little introduction about Oscar, what makes Oscar different, our 2022 product portfolio, plans, network, and more, and how to actually work with us. Oscar is the first health insurance company built around a full stack technological platform with a relentless focus on serving our members. We're using our member-centric approach and unique technology to drive cost savings and ultimately provide higher satisfaction for our members. We've created a time-tested model. So as you can see, we came about with the inception of the ACA, and we launched in the state of New York only back in 2014. Over the course of time, we've formed some strategic partnerships, introduced new products, and the most exciting thing this year is we actually went public on the stock market back in March. I had the pleasure of joining Oscar back in 2016, and at that time we were only in New York, California, and Texas. The main call out on this slide here is, as you can see, we've only really been around for about 8 or 9 years, but we've created a model that works, and our model is working because the growth that we've had over the course of these 8 years has just been absolutely crazy. The ACA individual and family market is truly our bread and butter, and it's the market that we know the most. So as we enter markets, don't expect us to be exiting or pulling out of markets. That's the exact opposite that we're doing. We're trying to go into as many new markets as we can each year. We do lots of research before entering a market to understand the dynamics, the networks, the other players in the market. So look for us to be competitive from day one. So who we are today, we're in about 22 different states, almost 500 counties, 3 product lines. So we have our individual ACA book, our Medicare Advantage plans, as well as our small group plans. We have just above 2,000 employees, and our annual revenue is now up to over 2.3 billion per year. We make our vision a reality by building a member experience that people love and want to engage with. Now, I don't know about for a service, whether it be insurance or something else. Typically, I get a pamphlet or an ID card or something that just has a phone number on there. I call the phone number. I don't know who's on the other line. I don't know where the call's being routed to. That's the exact problem we're trying to solve. We're trying to make every single member an extended part of our family. When members engage with Oscar, we can help them realize cost savings. We make it as easy as possible for our members to navigate their healthcare, which in turn has driven record levels of member engagement here at Oscar. And ultimately, that's driven lower out-of-pocket costs for our members. And the most important thing for myself and for the company as the whole is better healthcare outcomes. That's why our member satisfaction is second to none every single year. Now, our marketing team stole a little bit of my thunder here. I used to say that our NPS score was 10 times the industry standard. It's actually closer to 40 now. We've overachieved a little bit from last year. And basically what this is measuring here is how likely would an existing Oscar member recommend Oscar to someone else. So as you can see, we're up to 40 from 30 last year. The Oscar difference. We provide a more convenient, personalized experience with Oscar Care. So 2 teams I want to highlight, or 2 services, is our virtual urgent care service and our internal care teams here at Oscar. Now, high level here, we built some awesome tech tools, and we also have a human element that makes us different. We make it easy to talk to a doctor with our $0 virtual urgent care feature. That's why our members use telemedicine 7 times more than the industry average. Now, when we originally launched, this product was originally branded as Doctor on Call. We rebranded it as Urgent Care, virtual urgent care. Now, this service is available to our members on all of our plans, 24/7, unlimited, $0 from the very first day of coverage. Now, you might be wondering, when did we offer this service? We offered this from the very first day Oscar launched in 2014. So this service has been at the core of our success and growth from the very first day. I know when the pandemic, unfortunately, originally really took off back in March of 2020, we saw a lot of insurance carriers either beef up their telemedicine offerings, offer it for the very first time, offer it at a discounted rate. This is something that Oscar has been offering for the last 8-9 years. So we have a lot of data, we know it works, and we know that our members love taking advantage of this benefit. Something relatively new is members can now access $0 prescriptions through virtual urgent care. So not only are you able to get treated and talk to a doctor over the phone at no cost, but if a prescription is needed afterwards, it can be sent to a local pharmacy at your convenience, and you will pay a $0 copay if it's a tier 1 medication. How can you beat getting treated at the comfort of your own home, heck, maybe even your own bed if you don't want to get out of bed, and then having a prescription sent to the closest pharmacy near you? We have an entire team dedicated to every single member. We go above and beyond for our members. Now, whether that be just trying to find an in-network doctor, understanding a claim, or seeking care for the very first time, we're here to navigate our members' healthcare journeys. Our care guides add that much needed human element to the technological interface that we've built. It's really nice to be able to say we're a tech health insurance company, but it's all for nothing if we don't provide excellent service. And that's exactly what we do every single day. Our care teams are comprised of one nurse plus 3 care guides. What that means is that each time one of your clients calls into us, they're going to speak to one of the same 4 individuals, and those individuals are experts in the market that your client is located in. In other words, if they're located in Omaha, they're not going to be speaking to someone that's an expert in Dallas or Miami or Los Angeles. They're going to get the help they need and when they need it. So even with our employee base shifting to work from home for the last year and a half, basically, we've still been able to answer most calls within 2 minutes. And our member satisfaction score has stayed pretty steady at 4.5 out of 5. Wish I could say it was 5 out of 5 or 6 out of 5, but I think we're doing a pretty good job here. And I'm looking forward for this to continue as we continue expanding across the rest of the country. We make it easy to find the right care and stay in network. Members save $336 per year on average by using Oscar search tool to find care. Now, our search tool does all of the basic functions like looking up in-network doctors, facilities, looking for a reason to visit. My personal favorite is the medication search. Reason being is not only will it tell you if a medication is covered and what tier it falls in, the search tool on our website will allow you to click a plan that your client is either enrolled in or potentially interested in, and it'll tell you what the cost of that medication is pre and post deductible. Now, whether you're new school or you're old school, you can access the search tool directly on a computer or through the Oscar mobile app if you're a member. Here's an example of someone going through the Oscar care journey and the procedure being a hip replacement, which is very serious and very important. So it all starts on day 1 when the doctor submits a prior authorization about 2 to 3 weeks prior to the actual procedure. Someone from your client's Oscar care team will do a pre-procedure call with the member to make sure they have everything they need, they're comfortable, and they're ultimately ready. On procedure day, we'll be checking in with the hospital care manager to ensure everything went smoothly, make sure there were no hiccups. And then someone from the care team will go over discharge instructions just as a follow-up, and then also schedule any post-op care like therapy or anything else that might be needed. So not only are we making sure that you're comfortable beforehand, we're making sure that the procedure is going well, and we're also going to make sure that if you need anything after the procedure, we're there for you as well. Members can make the most of the Oscar experience by creating an online account. Now, obviously, the main takeaway here is I want you to go out and enroll as many Oscar or as many of your clients in Oscar. That would be the greatest thing ever. Now, the second greatest thing ever would be if you could get your Oscar clients to actually make an online account. The reason being is that online account will allow them to leverage everything I just talked about. This is where they use that search tool that's very easy to use, where they can request a virtual or urgent care consultation. They can call or securely message their care team. So, maybe your clients don't have time to get on the phone, but they can still send them a secure message. We've even worked to build out our Spanish speaking resources so that the language settings can be toggled to Spanish. And on that note, I should mention that I'm also a Spanish speaker. So if you have any questions while you're with your clients, you need help and they're Spanish speakers, I'm more than happy to help. And last but most certainly not least, my favorite here is the digital ID card function. I don't know about you, but when I sign up for insurance or anything else and I get an ID card in the mail, typically I open the envelope and I straight up throw the ID card in a drawer. And then when I go use it, I don't know where I left it and I'm scrambling and I'm late for an appointment or whatever it might be. So You can always access a digital ID card if you have an online Oscar account made. We have a mobile app that members actually use and love. I would recommend, if you have time, to go to the iPhone App Store or I believe is it the Google Play Store, the Android Store, and read reviews on the Oscar app. It is highly rated. This is where you can access everything that you would normally be able to on a computer that I just talked to you about by making an online Oscar account. The big call out here is members can earn up to $100 per year in step tracking rewards. So what that's going to look like is your client is going to get a goal that says something like, hey, if you step 4,000 times today, you've met your step goal. Each day you meet your goal, you get $1 up to $100 per year in Amazon gift cards. So make sure to have your client sign up for an online Oscar account so that they can download the app. They can take advantage of all of these free perks that I just talked to you about. Our 2022 product portfolio. So what's new this year? We have market and network expansions. Obviously, very excited to be expanding to Nebraska for the very first time. We're launching diabetes silver plans. We're offering supplemental products for the very first time. We've provided culturally competent care, and we'll be continuing that initiative for 2022 and beyond. And enhanced direct enrollment. Very excited to talk about this tool, so stay tuned. Just a heads up, I am extremely sick of saying enhanced direct enrollment. It doesn't roll off the tongue all that well, so I'm just going to shorten it up by saying EDE moving forward. Market and network expansions. Unrestricted access to Nebraska hospitals statewide. Now, I'm going to steal kind of a corny line here. We're not here to take part in the market. We're here to take over. So we're partnering with Midland's Choice to offer a statewide network for our year one launch. So as you can see, we have CHI Health, Nebraska Medicine, Bryan Health and Methodist in our network, as well as some other localized hospitals. Big call out here is year one, we chose to just launch statewide. I expect year two, year three, year four, and beyond to offer a smaller network as well as this larger statewide network. So stay tuned for more information. Don't feel like you need to memorize anything that I'm talking to you about today. I know that this recording is, this is being recorded. Plus, all of our resources are going to go live on our website starting on October 1st, and they will be presented in a very friendly way. So you'll be able to access like PDFs, 1 or 2 pages that have all of this information. But I am very excited to be partnered with Midland's Choice for our Nebraska launch. EDE, yes. You asked, we delivered. Well, not necessarily the Nebraska broker community, but the general broker community did ask and we delivered. So EDE was the #1 most requested feature from brokers in 2019 and 2020. If I had to guess, most likely 2021. This year, we're piloting an improved on-exchange direct enrollment process to enroll and renew clients with ease, straight from the Oscar broker account. So let me explain it a little bit differently. Oscar is this really young, awesome tech company, right? We lacked a tool that allowed you to enroll clients on the exchange directly through the Oscar portal, and that's something that we're implementing for 2022. What that really means is instead of having to go to an external website like Health Sherpa or healthcare.gov, you'll be able to not only quote your clients directly through the Oscar broker portal, but you'll be able to enroll them directly through the Oscar broker portal in an on-exchange plan. So key benefits, you'll be able to calculate your client subsidies for the very first time. And for future years, where I think this tool is going to pay massive dividends, is you'll be able to manage your entire Oscar book of business on the exchange in one central location. So you'll be able to easily renew your clients and or upsell your clients into a different plan. So what that means is no more having to go to Health Sherpa or healthcare.gov if you don't like. If you like that process, you can continue using that process. But here's a real life example of where I think this will be helpful. You sign someone up the very first or second week of open enrollment. They call back in the middle of December at the very last second. I should say the middle of January now that open enrollment deadlines have been pushed back a little bit and say, hey, thank you for enrolling me. I actually want to change plans before the deadline comes. Instead of having to go to Health Sherpa or healthcare.gov, you can go into your Oscar broker portal and make that plan change directly in there. So this tool will be available starting October 1st. So again, don't worry about memorizing this URL or downloading it. It will be available on our broker resource page, and you'll be able to register for this tool starting October 1st. Supplemental products. We're partnering with NatGen to offer supplemental products directly through the Oscar broker portal. Now, in the past, the number one piece of feedback is, hey, Oscar, you're a tech company. How come you don't offer an efficient and easy to use enrollment tool? We're delivering on that promise or that request. The second biggest piece of feedback is, hey, Oscar, what gives? You guys only offer medical plans. Why can I not offer my clients supplemental coverage? With this NatGen partnership, it will enable you to get appointed directly through the Oscar broker portal to offer NatGen's supplemental plans, which include dental and I believe accidental coverage as well. Now, two big call outs here. One, if you already are comfortable or have a preferred partner for supplemental coverage, you do not need to get appointed with NatGen. Number two, if you maybe already are appointed with NatGen, you don't need to get appointed with Oscar directly. Keep your existing process in place. This is really going to be helpful for anyone that maybe doesn't offer supplemental or maybe just wants to offer another suite of supplemental plans, more specifically to their Oscar clients. So this is already live on the Oscar broker portal. So that's where you first and foremost get appointed with Oscar directly. I'll talk about that a little bit later. But this is also where you can get appointed with Oscar to sell NatGen supplemental plans. And obviously it will be available in Nebraska and actually throughout most of the central region. Wouldn't be sitting here talking about it if it wasn't going to be available there. So if you'd like more information on supplemental plans, just go to hioscar.com/supplemental. And yes, here's what it would look like when you actually log into the Oscar broker portal. So there will be a section in the middle that says start selling. And then at the very, very bottom, it'll say sell supplemental plans, and you can get appointed to sell NatGen supplemental plans. Diabetes silver plan or plans potentially here. This is something that's near and dear to my heart. My little brother is managing type 1 diabetes, so I'm actually excited to see Oscar offering a plan that will hopefully combat diabetes much better. Now, the big call out here is we're physically naming the plan something like Oscar Simple Silver Diabetes Plan, but you don't have to be managing diabetes to enroll in this plan. Any person can enroll in this plan. The only reason we're calling it the diabetes plan is we think that some of the benefits on the plan will be helpful and be efficient in treating diabetes. So it'll have a $0 copay for eye and foot exams, $0 copay for diabetic labs, $0 copay for PCP visits, as well as out-of-pocket costs for insulin capped at $100 per month. Now, the two questions I usually get are, hey Seb, does that mean that any insulin is covered at $100 a month? That's going to be any insulin that is in our formulary is covered at $100 a month. And then the second question I usually get is, hey, what gives my clients insulin is not in your guys' formulary? There are special exemption requests that can be submitted with the help of a primary care doctor usually to get the insulin covered. on a case-by-case basis so that it meets this criteria. Culturally competent care, yes. By leveraging our consumer-focused technology and personalized member experience, we've set out to help members find care that is culturally sensitive. So some top initiatives from this year, we've deepened the connection between the member, the provider, and the health plan through inclusiveness and representation. We've made care more accessible to those who encounter any sort of systemic roadblocks, and we've reduced racial disparities within the healthcare experience. Now, if you notice, I skipped the very first sentence in point 3 because I do want to highlight this. Again, our end goal is to improve healthcare outcomes for all of our members. That is the most important thing Oscar can do. Some key accomplishments. So we've collected provider data for thousands of providers that include race, ethnicity, and language to support member search preferences. What that really means is when you use our search tool, there will be tons of filters that you and your clients can take advantage of that include, filtering by a specific language that providers might speak, race. So we try to make it as easy as possible to use our search tool, and most importantly, make our members feel comfortable in finding a provider that they actually want to see. We've launched our corporate giving program to support nonprofits that address healthcare disparities in our markets. We're also pursuing NCQA multicultural healthcare distinction and including both programs as part of our corporate equality board accountability. Last but most certainly not least, we've also piloted some member experience initiatives to improve member satisfaction and overall healthcare improvement. 2022 plan spotlights. Now, before I begin, I want to preface this by saying 2 things. 1, the plans that I'm highlighting in this presentation are not the only plans we will be offering for 2022. I've actually gotten this question. There will be many more than 3 plans offered. I'm only highlighting 3 for the sake of time and not having you fall asleep. The second thing I want to call out is pay attention to the name of the plan. The name of the plan is going to highlight the benefit or service that we really want you to focus on. Now, in the past, I'll be honest with you, our plan names have been very bland. What I mean by that is our plan names have been something like Oscar Bronze Classic, Oscar Simple Silver, Oscar Saver Gold, Oscar Elite Silver. This year, we're renaming our plans again to highlight the specific benefit that we want you to focus on or really leverage to your clients. So in this case, this plan is called the Bronze Classic Dash 0 PCP. Why do we like this plan? It's a bronze plan with $0 PCP visits, copays from day 1 on urgent care and tier 1 medications as well. It allows for access to care at bronze tier pricing with better benefits versus post-deductible bronze plans. Now, who this plan is good for? Any one of your clients that regularly visit their PCP and want access to regular wellness visits. So maybe you have someone that says, hey, I like to go to the doctor 4, 5, 6 times a year. This is definitely a good plan for them. Anyone else that might be looking for a plan with a relatively low premium, again, comes in at that bronze tier and has that $0 primary care copay. Next plan I want to highlight is Oscar Bronze Elite Dash $0 deductible plus specialist saver. Doesn't roll off the tongue all that well, but trust me, I think the transparent plan names are going to be a hit this year because they'll highlight the benefits that are the most important on the plan. So in this case, $0 deductible with bronze tier pricing. It's the alternative to high deductible co-insurance based plans, low specialist and PCP copays. Now, who this plan is good for? Anybody that's subsidized on the exchange but does not qualify for CSR plans. Anyone who's price sensitive but wants the transparency of upfront medical copays. Again, we're all about transparency and trying to make our plans as transparent as possible. And members who want to make or who plan to make 1 to 2 specialist or behavioral health visits per year. I'll give you a specific case study of who would be good for this plan, or who might be interested in this plan. Me, myself, and I actually. I manage asthma. I have that as a chronic condition, unfortunately. I actually do see a specialist about 2, sometimes 3 times a year. So for this plan, I would be able to see the specialist 2 times a year at a $50 copay. Moving forward after those 2 visits, it would actually be a $125 copay. Oscar Silver Simple with Specialist Saver CSR 200. Why do we love it? Low deductible, pre-deductible copays for the most routine care. It's the alternative to high deductible co-insurance plans. Who this plan is good for? Anyone that's subsidized on the exchange who does qualify for CSR, which is that cost share reduction program, and any members who are price sensitive but want upfront medical copays. As you can see, this plan provides copays for the most routine care. I would say most people in a year maybe go to a wellness visit and maybe go see their doctor 1 or 2 more times. Maybe they go see a specialist 1, 2, or 3 times. And they also like having a copay to urgent care so that in the back of their head, they don't have to worry about going to an urgent care clinic and not knowing what they're going to pay after they, consult with a physician there. So we use the highest quality partners to build a connected patient experience. CVS Caremark is our exclusive pharmacy vendor, and we offer $0 prescription home delivery through CVS Caremark's mail order service. Now, the other important thing here, all of our plans have been from day one and will continue to be ACA compliant. So that means that by default, they include pediatric dental and pediatric vision benefits. And what's really exciting is in the past, we've worked exclusively with Quest Labs, but we are adding LabCorp for 2022. So some more options, for your clients to actually pick a, lab near them. Product demo, yes. I'm actually going to skip this slide because the next slide will highlight this same exact thing. So this product demo is able to be downloaded directly through the Oscar Broker portal. Now, what this demo is highlighting, which I'll walk you through when it starts over, is someone using that virtual urgent care function that I talked to you about earlier. If you're able to download this from your Oscar Broker portal and show it to your client, I think it's a wonderful benefit to highlight. And again, it's $0 unlimited 24/7. So let me walk you through it as soon as the spinning wheel is done. So here, first you're going to request, a virtual urgent care consultation. Then you're going to select what issue you might be having, and then you're going to describe your issue. So in this case, my skin has a rash. Then you can add a picture of whatever symptoms you might be experiencing so the doctor can see, what you're going through. The doctor will again have access to that picture you upload. Then you can request a call and select a convenient pharmacy near you in case a prescription is needed. So it's going to show you what pharmacies are nearby, and then it's going to have you request a call, and that's as easy as 1, 2, 3. So again, this benefit is available 24/7, 365, $0 copay. Make sure to highlight it to your clients. I promise they will take advantage of it and love it. How to work with us. So all of this information that I just talked to you about, the high level information in terms of plan overviews, plan docs, network overviews, deep dives, all of that will be able to be found on hioscar.com/brokers. This is literally your one-stop shop place to get anything and everything you'll need. And then also, I'll talk a little bit more about it in a second, but our broker portal can be accessed at business, www.highoscar.com. This is where you go get appointed, quote, and enroll your clients and manage your book of business. Now, again, I would potentially write down or try to memorize highoscar.com/brokers. Memorize it, jot it down, keep it in the back of your mind, highoscar.com/brokers. This is your one-stop shop to have access to anything and everything you need. Plan documents, network documents, register for future events that we're hosting, training resources, and what I like is they've actually added that search tool that I talked to you about earlier on this page as well. So for those of you that field questions from your clients that say, hey, is so-and-so in Oscar's network, you'll be able to access the search tool yourself as well. The Oscar Broker Portal makes it easy to work with us. Again, that's business.highoscar.com. This is where you quote and enroll your clients. You can view your book of business and commission statements, track member engagement, get appointed. All that can be done in one central location. My favorite benefit or tool besides EDE, which is launching and I talked to you about, is you have access to all of your clients' ID cards. Now, I don't know about you, but in past years, one of the biggest issues or questions I've fielded is, hey, my client signed up in December. It's now December 29th. They don't have an ID card. What gives? One of two things. One, you can instruct your clients to make an online Oscar account so that they have access to a digital ID card before January 1st. Or number two, you can also print out a full sheet copy of their ID card, or you can save it as a PDF and email it to them. At this point, there should be no excuse why all of our members or your clients don't have some sort of copy of an ID card before their coverage begins. This has been an issue in the past, but it won't be an issue moving forward. And I can definitely understand the frustration there. I would hate signing up for a service and not having access to it. So again, one of two things: make an online Oscar account, digital ID card, or you can print out a copy of that for them or email it to them. Payments spotlight. So I did talk to you about the number one most requested tool, which was the EDE. Number two most requested thing was offering some sort of supplemental coverage. And number three is payments. Now, I'll be 100% transparent with you. That's one of our company values. Our current payment tool sucks. What I mean by that is presently, when you go enroll someone on Health Sherpa or healthcare.gov, once you hit the enroll button, the next step is, hey, I want to get my client on auto pay or at least set up their payment settings so that their premium is paid. You as the broker get paid, we get paid, everyone's happy. What happens today is when you go make their first payment from Health Sherpa or healthcare.gov, it'll either one of two things: load a blank page, total frustration, or instruct you to log into your Oscar Broker portal if you're not already logged in, and will make you fill out all of their demographic information again, plus the payment information. What we're doing to improve that is, for 2022, all demographic information will automatically be imported so that whether you use our internal EDE tool or you use Health Sherpa or healthcare.gov, when you go to make a payment, all of their demographic information is imported automatically. So the only thing you need to enter is payment settings like auto pay. Would you like that on? Paperless billing. How will they be making the payment? This will save so much time and so much frustration. It's definitely been a close third place in terms of feedback from the broker community. So I'm excited to see this launch. The other call out here is we want to be cognizant of clients who are maybe freelancing or bouncing from job to job with the pandemic still going on. So you'll be able to make payments on their behalf for full amount of premium, overdue amount, or a partial payment. I know the other big feedback is we've had people who need to split up their premium payments into 1, 2, or 3 payments per month. Totally understand, want to be aware of what's going on, so we're making that available as well. Our broker support team is here to help. So anything I can do or assist with, our broker support team can do just as well, if not better. So definitely want to get this contact information down. It will be available at the end of the presentation as well. But you can email them at brokers@highoscar.com, or you could give them a call at 855-672-2713. Again, anything I'll be able to assist with, they'll be able to assist with as well. We're here to win your trust and ultimately earn your business. We're going to provide the help whenever you need it and also when your clients need it. We're going to make it as easy as possible to do business with us, and we're going to provide competitive compensation. So again, between the knowledgeable broker support team, plus me being your dedicated market contact, and our robust broker resource page, which is again highoscar.com/brokers, we want to make sure that you have anything and everything available to you to make sure that you can sell Oscar. We want to make it as easy as possible to do business. So again, simple online enrollment tool that we're launching, easy to manage book of business. Everything that we build internally, again, we are that cool, young, hip tech company still, we own from the ground up. So whether that be our broker portal, our claim system, our care system internally, we build everything from the ground up. And for compensation, stay tuned for more information. Our commission program will go live starting, I think, October 1st. And I believe we'll also be offering some sort of broker bonus program. So just stay tuned for more information. I'll make sure that it gets out to Nate so you can pass it on. And anyone else that has questions, just let me know. I want to say, I'll come back to this. I want to say first and foremost, thank you so much for attending the webinar, sticking it out, hearing me out here. And if you have any questions, I think now would be a good time to enter them in that questions box that you should have access to. I do want to keep this slide up. I think I ran exactly 45 minutes on time, Nate. So you know, I'm more than happy to field some Q&A if anybody has some, or if you want to just give some people some time back before the next person presents.
Yeah, thanks, Seb. We do have a few questions. There's a couple things I wanted to touch on too, but I'm going to go through because some of these have kind of been outstanding. I've tried to answer a number of them just privately, but one of them was approximately how many clients does a 4-person care team work with?
It really just depends on a market by market basis. I think the figure now is at, I want to say, I think it's like 3,000 to 5,000 members on a per care team. Now, again, it's just going to vary market by market. So some markets where, like for example, Oklahoma, our membership base isn't as big there as say like Dallas or Florida. So it's just going to vary by market, but anywhere from 3,000 to 5,000.
Perfect. One of the other questions, will Oscar be offering any HSA plans?
Stay tuned for more information on that. We're finalizing our plan portfolio, and it's, I believe it's either pending regulatory approval or just been approved, but stay tuned for more information there.
Okay, so do you know in other states where you have HSA plans, do they offer the $0 virtual visit and the $0 tier 1 RX?
That actually varies market by market. So there's some states where regulators are a little bit finicky about offering virtual urgent care at $0. I know like in our home market of New York, that has been very conflicting at times. So as soon as our plan suite is approved and live on our website, the benefits will be available to view in terms of, you know, if it's an HSA plan, will virtual urgent care be $0? I would say that out of 10 markets, usually 7 or 8 out of those don't allow us to offer virtual urgent care at a $0 copay. Usually it has to be I think usually in those markets it's like $10 or $20. It's $10 or $20 copay.
Do all plans have kids dental and vision?
Yes, all of our plans are ACA compliant, and we're committed to keeping that. So all of our plans do come with pediatric vision and dental by default.
Perfect. A few more here. On the Oscar $0 deductible plan, are there copays for things like lab work, x-rays, etc.? I would assume that those probably go to the deductible or the co-insurance.
Yes, those would apply to the maximum out of pocket on the plan. So those plan spotlights that I talked about today, I was just highlighting a few of the benefits. As soon as our plan grid goes live on our website, you'll be able to view all of the copays on that $0 deductible plan. And yeah, the copays do apply to the maximum out of pocket for the year.
Can a member make a binder payment over the phone by calling member services? And do we have that number?
Yes, of course. They can call member service or their care teams directly. And let me read off the phone number. So I'll read off slow and everyone can write it down. It's
I am typing this in the answer so people will have access to it too. So
okay. The phone number is just 855-672-2755.
perfect. Let's see. I know CVS is the exclusive pharmacy, but out in their area, they have no CVS. What other options are available? I think you guys have almost all of them in network, don't you?
Yeah, so CVS is our partner, but we also have like localized and other pharmacies in our network. The one that I always get asked about that isn't in network, unfortunately, is like Costco. But we do work with other pharmacies. It's just that CVS Caremark is our partner. So it's not an exclusive partnership, but they are our partner for our formulary.
Perfect. What is the network for dental and vision?
So that is actually accessed through our benefit partners website, which is, I believe, Davis.
Davis Vision.
Yeah, Davis and who's the pediatric dental? I can't think of it off the top of my head, but benefit or the network information is accessed through their site.
Liberty, does that sound right?
Yes, Liberty, that's exactly who it is.
Thanks, Tom Lancaster, for paying attention. Let's see here. Last one. I've had a couple people ask about out-of-state coverage. From when I was talking with Matthew when he was here, I do not believe you guys offer out-of-state coverage unless it's for emergency-related services because you're using a rental network. Is that correct?
That is correct. And the other call out is that virtual urgent care service can be used outside of Nebraska. And if there's an in-network pharmacy near them outside of Nebraska, they can still leverage that as well. So say, for example, someone's visiting like Los Angeles, let's just say. If they don't feel well, they can still talk to a doctor at no cost, depending on the plan. And if they need some sort of prescription, if there's a CVS near them, they can pick it up outside of Nebraska.
Perfect.
But to answer the question, yes, outside of the network, it's really only emergency coverage.
Perfect. I think that's all the questions. I have a couple things real quick. Seb, I know you guys talked about contracting with Oscar. Most of you, I believe, just kind of looking at who's attending, are already set up with Oscar. If not, please contact our contracting team and they will work on getting you set up. There is some nuances as far as making sure commissions funnel through OCI, just like with all your other carriers. So we want to make sure that that is set up correctly. So if you have not been contracted, or you need to transfer your appointment, please talk with our contracting team here at OCI. Seb also talked about EDE. We will be talking about that during my presentation at 2 o'clock, going over Health Sherpa. We'll also be talking about NatGen and their platform, so very similar. As far as getting appointed with National General, we do ask that you reach out to our contracting team as well. I know a number of you already are. But we'll talk about that later today at my presentation at 2. Compensation, I know they're not able to release anything, and to be honest, I don't even have the comp yet, but I can tell you we work with Oscar in a number of other states, and I would be shocked if this changes, but they do pay a per member per month. anywhere from 18 to 25, depending on the market, with a max of 5 lives per policy. They do offer some bonus. They did offer some bonuses last year, again, depending on market and your member block size. So stay tuned. As soon as we get that information, we'll make sure to pass along to you. Seb, one question up for you. Billing, when do you guys pull EFT?
Sorry, could you say that one more time?
Yeah, if somebody sets up automatic payments, what day of the month do you guys pull on? Is there a set date, or is the member able to pick that?
Yep, so usually it's on the very first of the month. Now, what I always tell people is if the first falls on like a Saturday or a Sunday, usually it'll be on the next business day, but it's usually on the very first day of the month for auto pay.
Perfect. Seb, again, I thank you very much for your time. Again, we've worked with Oscar in a number of states and have been extremely happy with their customer service response team, their broker support, whether it's the email or just phone number. Their response has been fantastic. I know that's been a frustration with some other carriers. So really looking forward to working with Oscar going into the next year. If you have additional questions, feel free to reach out to our individual sales team here at OCI. And with that, we will go ahead and take a short break while we get set up for Medica. And Seb, thanks again for your time.
Yeah, thank you for having me, and thank you everyone for listening in. Nate, I'm just gonna add one more thing. If anyone is already appointed and needs some sort of like an adjustment, like they don't have OCI listed, or again, any adjustments, just holler at me or Matthew so that we can get that taken care of before open enrollment begins.